At Radio Pacis, talk is part of the game. Debate and variety.
Yes, talk is part of the game. Indeed, that's a song done by Sincere, and that brings us to 12 minutes past 7 p.m. Listener, you are most welcome for this edition of the talk show right here on Radio Pacis 94.5 FM. Peace of Christ for all. Today, I can see the rain. Yes, we are blessed with that rain, and we thank God for that. But of course, earlier on I did say I'll also be expecting guests for a talk show sponsored by Sehad right in the studio. I have the guests, and we shall have this for 1 full hour from 7 p.m. up to 8 p.m. and they will tell us more why they are right in the studio. And to be part, you'll be, of course, calling in through our studio lines, which are 0701 88 77 08 and 0393 273 and 232. Our message line for your SMS is 0788 95 64 and 94. We also appreciate all who are listening to us online, maybe from Canada, Toronto, wherever you're tuned to following us from. We appreciate. My name is Chekechan Moses, also known as Chek, and let's get to the guest in the studio. Yes, I have Mr. Echero Peter, who is the program coordinator for advocacy. You're welcome.
Thank you very much for hosting us here. We are excited to be with you.
Okay. Yes, another in the studio is Madame Adatero Natalia. Natalia, you're most welcome.
Thank you. Our four Radio Pacis Mini. Azimora tisiba America and Veralele.
Migida Maluba Tiabo, Ildia Manichuti, Miazinga, Ngwa, Kalankobe.
Our fourth are Roma Tia person can go to Billy Arua District Council Social Services Committee. Rio Onita Pivler on Alatavler Virtro. So Memudra Kala Alatavros our
that means that she is the chairperson of the Social Services Committee of the Council in Arua, and things to do with education and health, yes, is where she handles. Okay, and the other one is Mr. Alfred Okonji, the chairman, LC5 Arua District. You're welcome.
Thank you very much, my brother Chek. Good evening, listener.
Okay, yes, so we shall have this discussion in English and Lugbarati, and feel free to comment where possible at the right time. Right now, let's get to the opening remark. Yes, Mr. Echero Peter, the program's coordinator. You're welcome.
Thank you very much, the host, for having us in this radio talk show, where we are coming to discuss one of the things that we think is very important in our community, and that is a question of social justice in health, access to health services for people of this district and a number of other districts where we are working. So as Center for Health, Human Rights and Development, the organization hosting this talk show, one of the areas we are very concerned about is access to quality and equitable health services for everybody, including those who have money, but also for those who do not have resources to pay from their pocket to access health services. We believe that health is a fundamental right, and it means that each one of us, regardless of where you come from, whether you're rich or poor, somehow you must be able to access health. The qualities may be a little different, but it is important, and that's why we have a government that we put in place and we pay taxes to. And government every year allocates resources for ensuring that everybody is able to access health. So this is the discussion that we come here to have today. And the project that brings us here is emphasizing the role of communities in improving health for everybody. That means that communities should be able to interrogate, to interface with health service providers, for example, the in-charges. We now have here the Secretary for Social Services, and ask them the hard questions about why, for example, there may be challenges in the health sector. But also, as part of what this project seeks to achieve, is ensuring that there is money put in place for health that is adequate. Now, health financing is very important in terms of the quality and ability of people to access health care. If you do not put in resources into health, then you have a problem. Currently, in terms of the overall budget of a country, we have about 6.1% going towards health. And yet, as a country, we have a commitment that for us to achieve universal health coverage, that is a situation where everybody can go to a health facility and get health services regardless of their class, economic status and all that. We will need to allocate 15%. So we think that consistently we still have a challenge in terms of financing for health. And that's why we come to have this conversation so that communities play their role. One, in encouraging political leadership to take a conversation on, do we need to finance? Because the money that the financing for health determines a lot of things. It will determine whether you have a doctor at your health facility. It will determine whether you have medicine. It will determine whether if you go to a health center for a district hospital, whether you can access blood when you need it. All those things have cost implications. So when you're unable to put in resources there, then all these other things in terms of blood, medicines, personnel and all those things will have a challenge. So we come for these kind of conversations to create a platform for those who hold public positions to be held accountable by their people who elect them. So they come and explain to communities about the status of health, what needs to be done, what are the challenges, how do we deal with the challenges that we have. That is what this platform is supposed to provide. Now, in this project, one of the things that we did previously was to conduct monitoring in health facilities in Arua District.
And what was the outcome?
The findings were stuck, and they are similar across most of the places in the district. One of the things you'll find that in all the health facilities, a lot of times, when medicine comes, it doesn't take 2 weeks, and it is finished. And therefore, for the next month, until the next supply by National Medical Stores, there's no drugs in the health facility. The other thing that we found as a challenge was that in some places, there were shortages in terms of staffing in health facilities. So if you look at Arua District generally, it is one of those districts that is blessed with the high staff levels across the country. They have about 79% of positions, approved positions filled. That's according to the Ministry of Health. So that shows that they have a lot of, at least a fair human resource. But it is not cut across everywhere. And then again, when you go to a lot of public health facilities, even when they are supposed to be staff who are on payroll for that health facility, you actually find that they are not at the facility at the time we visited. If we looked at averages,
why? Is it because the drugs are not there, as you said before? Don't they have what to do?
And that is a question that is difficult to answer. That people are being paid to be at health facilities, but they are actually not there at the time they are supposed to be there. So across all health facilities we visited, when you enter in and you ask whether they are in, most of them were actually not within the health facility. So that's one challenge. And probably it goes to the question of supervision and a number of other related issues. Then the other problem that we found challenging in specific areas, for example, if you go to Bondo, I think it's one of the only health facilities that does not have a fence. And you know that is problematic because it compromises safety in a health facility. First of all, the people who work there will not be willing to come out of their houses at night to attend to patients. But also it encourages people to grab land. People start getting into hospital and slowly by slowly. So that's one of the things that is unique, I think, to Bondo Health Center. Then the other thing that if, for example, we want to increase participation of communities, do they have information? Do these communities, for example, know how much money does their health facility receive in a year? Is that information provided in a public place? Because that's what the law actually requires, that all this information must be displayed. But are they being displayed to enable, for example, if a councillor goes into a health facility, are they able to just see the information? Or even these people who health users, if they go, can they know that this health facility receives this amount of money?
Who is supposed to display that?
The law requires that those who are in charge of the facility must display some of this information so that other people can use this. Then in some places, because Health Unit Management Committee represents the community in the decision-making process. But in some places, the Health Unit Management Committees are extremely weak. They just come in when they hear that the money for the quota has arrived. Then they also arrive at the health facility. But throughout that whole time, when there is no money, they are nowhere to be seen. But I think we had a good example in Bondo, where the chairman is really, if you look at the visitors book, he is at the health facility a number of days every week. And I think that is a good thing. I don't know whether it is a question of capacity building for everybody else, including other members of other health unit management committees. That could be one of those things that is important to be done. So a lot of these things, some of them may look really minor, but they go to the heart of health service delivery, why we are incapable of ensuring that people are able to reach these facilities. Then also, you remember that when they established Health Center 2, for example, it was meant to serve 5,000 people. But I can assure you the Health Center 2 that we found that are serving almost 30,000 people now in this country. And so, when they gave them staff and medicines at the time of establishing them, what was clear was that they thought they would serve 5,000. But now they're serving 3 times the number of people they were supposed to serve. And yet they are having the same number of health workers. They are receiving almost the same amount of drugs that they're supposed to have received. So it becomes a very complicated issue. And so it goes into challenges where communities start saying health workers are stealing drugs. They say they steal mama kits and sell to them. And yet, in reality, you'll in most cases find that mama kits supplied are way too low. You find a health facility receives in a period, in a quarter, about 36 units of mama kits. Then the same health facility has 50 deliveries in a month. So that shows you that even the mama kits that are supplied are not enough for just one month for that facility. But it is expected to last until the next time they are receiving the next set of mama kits. So
now how comes the people are reporting that they are being, they think the same things are being solved for them, meaning something is happening, only that they're lacking evidence?
Yes, it could also be true that there are cases of theft and then they sell to them. But also there is a gross undersupply. Of course, in some places they were clear. Even the health workers admitted in some cases that yes, sometimes we've asked for money from communities, but it doesn't take away the fact that even the supplies that we get are way below what we need for that health facilities that we have. So it is a big challenge that we need to deal with as a country. It's not as a problem unique to Arua. It is a problem that is unique to Uganda as a country. Because one of the things you'll notice is that the current staffing norm that we have was last established in 1989, when we were just 21 million people in this country. We are now in excess of 40 million, and we are still using the staffing norm that we used while we were 21 million. So it's problematic. We need some things require policy shift, others require operational issues at the sub-county.
Okay, thank you so much. It's good that we have the government representatives right in the studio. They'll tell us as well how they are prepared to handle the challenges. Anyway, thank you so much. That's Mr. Echero Peter, the programs coordinator. That is for advocacy. Thank you. Time check is 27 minutes past the hour of 7 p.m. Listener, you're listening to Radio Pacis 94.5 FM, Peace of Christ for All. My name is Check in the studio, our guests from Sehad. And yes, now let's get to a bit of it in the local language. And of course, listen at the right time. You'll call in through our lines 070-188-7708 and 03932732. And that's 32. People were already calling as you were talking. Maybe before you forget, put it down, write it and text it through this SMS line, because I've not yet started picking up the calls. So if you have questions or any comments, please, the line for you to send a message on is 0788956494. All right, let's get to the lucrative one as well. Maadimia E ataza the Tero Natalia. Yes, the chairperson Social Services Committee of the Council Arua District. Zamana doda kandi ndido garabati midi fimutia afati kuerando ane.
Our first Saro. Ba meripi amfedaledi. Our for Radio Pacis ni. Our file vine fe amki banon fele se hadidini.
Efene midinga maniodi iji kumpelempelero. Efene nzeta angoni ari. Midivini mivro badinaben.
Muka our first Saro. Eyo bambu pitani do anjere erangiri. Eyo alata kala rojoria. Lo amani do akini yibiati ameselesi Arua District ya. Arua District ni sasa makaduira dansi Uvra County. Alenya sub county di ya Rivo E, Ajie Vora sub county E, azini Logri sub county E. Ani yina tiri ameselesi arozopi malesi muzi yu nizo eyo yepi arozopi malia di lobo amani kini diledini. Kini yina tiri ya yisu pale karakararu aroni tsadini baron idembelia. Ya I arozo di pimale si woro aro kavini tsadini bari idembelia yisu vini ya aziniri arozo di pimalia bate azingapi Dr. Rudi sa azini malia idivina ayo yini di atita nde di ma ali andra tira yiri divina usu badi divina sa azini malia ayo adi osia zidiru adan sitama zizi dini yini vini atiria yisu ba arozo di pimalia di etetasi arozo amavu dia di pima afayo karatasi dika vini seta di etetani ankiri turibondwa kini baswana arozo di pima kalako fencing ifini kini bani di arozo di pima kala sole kursi ama divini ba kule di ruwa mavini edro nyakunde ta arozo vler mati prosi were ibusi alura ibusi rira afadaleri yine eronzi dari eronzi saro dika bani vina arozo makala so kursi ifini kini daktari lati dadi yini security kan kuna gate ma yivile azini yivile family ni di yini naria erivini nde ewaru werendi yimovini su ba kuwe di yini yuziria were ni wadi yo afabani fela rojoa kanaroni kanisendeni ni yo afadi pimadire piripiraya yisu kini ba kuwe di nini toni yo afadi pimadire ko zidirvin lo amakina ni yo diki ya dina yo sia yo aveni ro akini yena atiria yisu kini bate bani ndrope arozo magi tezo banon vele health management committee rudi munditi sidia mbele arobombe hiyo mikidini ba hiyo mikirudi mazi arozo aziri pimalie muni arozo de andri mbele ba azinga pi daktaru da de andri mbele dini ko tefediru aveni tata bondo health center si kini yisu tia person bondwari erma emuta arozo ari ndikindini wore ti ifini kindari refe azite ba management ya dipini nga dika ba lata mazinga pi amaru dipi di yini gazorsi era amuke letaba hiyo mikitia person zero azini committee rudi madu iteta ba bondo da pivuri imuzu iyo di kiandizu mbele ovene lu yimu da sawa aroni tazorsi kare kuni sende ka defi bo idilu imuda sende dia locating ngoni ku lememu arojo atiti erani fazinga za arojo arneta kililiro ngadiru aveni okene arojo ndadi yinivina tiria kala semu pi arojo di yankirto agandra bani de planikini arojo dringa arose ba dipini tesasi kala feni tutursi midini su arojo di maria ba makala feni ga aga bani tutira yo dari yinevini rinde e waro ba azinga pi arojo dipini etetasi betoto yokini arojo bono center dale ri sote ba ne udulo lo skanili futuia kani turusu angoni ani temisu udula maria bakimu badakaru erde ani fe ba health workers rudi yinde vini ta ruti anyopie lete dale maza ba makora dini di dovu yo erninte amani angiri pari taondra ine tisu arojo amavuvura kana kuna Arua district ya di Pimalia eteja amani yondidi ngadiru aveni amani keni eyo di mazidi amate di ba leaders ru kan ku political leaders ru di yimani sadi amavo di dovu yo erninte munduti sidwa were di our
ministero ma de belendi muasi mevo efene mi bibita ngara mala la lubaratisi wale tadi ansanere mevo mtadi district leaders rodi ilu milu dinga mani dika lubaratisi mi district Arua Maria azinga dolari azini di efede amani on vitara chuti efene onono waba tuni fe kakara Maria otuta minotu office in Maria ringoni yor mazakozo bati diba semi gbate ba ringa mtiesi rakaka
muka war fo saro ekle chairperson committee social services civil ro azi amaje de balangiri alonezo kini arozo di Pimalia sende bani se kan kun bani uti bani ba budget Malia re lete mata arozo alo Pimalia aro bani uti amani swingazo joint medical store vore gamete urlele ruvore lete mata baka fedini bo mata kilili then aro nde bani ledi aro bani ledi yitengo di etetasi azo amavu akwedia totodi ingodi baka information du de baka details nkidu di lebo letaro da meta amavu arozo di Pimalia azitani lerle dika ba azinga pia rojo di daktari rodai sawa yini muzu aziri ringoi dika sawa yini bapi na rofeso di ngoi amadina kini sazin Maria ejo waru ya riri jo bazi baru deni lazori etoni atako area Arua district edia jo ba alata mazinga pidini tetozo lazo gogo arojo da di taniko ani ama utitabe yozo kini lete arojo di Pimalo alo Malia staff houses kan kune residential houses for the staff joba people alata mazinga pidipine lazore ma arojo do gogoti ngani ani saweza chiria andruru diniku tesa difiranga esela toza danga wereti sele ni takursi amadi mu utitanda de ba zonje di isi isetasi ile vemu pidi Malia amanga yemu staff house kan ku joba lapi arojo amina alata mazinga pidi lazo gogore ama yemu isi lazebu health center azina maba ayaye askuni dalu tefyalo lazebu avin dile erani first staff kan kuni bata zinga pidi yidivini ngare azini sozo kavini yili girkwaya kan kuni pipikite yini muso atipata yini musuri kavini iza girkwaya ifirikini etoni sadalesa ekermali yako dinga kristalenzi zoro were ti ya no district area awanso
efiniyo sawa voda satambaza voda mini yore si biro tutuniyo jo akoni kana ku jo akovre si jo kana ku bari ni lazo ni tsazo koresi te dibari mazikiti akatare mantere jarsi aka area mkiliria mataka akava kiliria bari maziki kimu aziera temisu dekia danisa voda ta banta lera leko asitan lera la zikiliku adiri kimura kezinga wera misuku avigite askulu bari maziki dimu yo de mapavu andrisiri edi mutasa dari divini skisu yo efini sara malaiki da ati kidibungwa indi bari mapavu andrini ametoro mazaka ngon
mecha tela la war fosaru mecha tela ya ware ya waru de mazalo ni ya waru azir dibane adrisa attitude ba zibaru di veledi chazir mali ya tona oni rukwiri adani amandi atiria amadi afadi azisu were ndi ese tasi staff ni temu buti si re adapti terimo tasi sa aziri erdayo teden asa ivlete duty vlerko ya dia noni ani me dena makadi iyo lady kisubo amadi report ici amadi o de fait amavle district health officer DHO madudinga yo de maziki administratively ifini kene staff daler non fait e meeting yo yipie erina advice fait kadi e mukaku le maferne warning denga podi amadun di tough decisions. You know, political decisions are very tough decisions. So we normally advise our heads of department to handle those things first of all administratively. If the staff does not now adhere to that, then it comes to the committee. So when it comes to committee, we forward it to the council to say that staff ABCD has gone through this, even through disciplinary, but is not adhering to the advice given by the head of department. Therefore, at the committee level, we have done ABCD and we have now forwarded it to the council. The council can take decisions because the council is the one who employs these people through this service commission. So we have measures to disappoint them also when they have not taken the advice of the heads of department. This one we are following it very seriously. We do not fear or favor. And the people of Arua and staff, especially the staff of Arua, the current Arua now, we are now Arua District. We are now very small, a small area coverage, and leaders can reach anywhere, anytime. So I am asking and requesting the staff out there to improve on their style of work. Let them change completely. It is no longer we used to. No, we are not now for we used to.
Thank you so much, Madam. Time check is 21 minutes to the end of the talk show. That is to 8 p.m. Let's also hear from the district chairman. Yes, you are here. Please, you're welcome.
Thank you, my brother Chek and our colleagues from Shehad and my colleague Chair, Honorable Natalia. I must say I thank Shehad for supporting us in this baraza. I also thank the community members for bringing their concerns out, and indeed this is the way to go out. Now, the issues that have been brought out here, as a district, I think we have acknowledged them. We have taken them positively, not negatively. I want to start by medicines not being enough in health facilities. When they come, they get finished within short days. The answer is very simple. Per capita allocation in health sector by government. I have figures here. If you look at Arivo, if you look at Bondo Health Center, the per capita allocation per person to get treatment in this health center is 2,208 shillings. 2,208. This is for a whole year. If you look at Ajia per capita allocation is 1,492. This is according to the population in the health facilities that they are serving. So, in a nutshell, the per capita allocation is not enough. Now, what does this call for? This now calls for prevention of diseases at a household level. And that is why our VHTs are running around to say, please, let's have pit latrines, let's have bathing shelters, and these necessary commodities, the requirements of a home. So this is very, very important. Otherwise, the allocation per capita in health is inadequate. Secondly, we are expected to contribute more than 15% of our annual revenue towards the health sector. But what is it now? In all the sectors, our stand is at 13%, which is inadequate. Now, in developed countries, it is expected that we have to survive at 20%. As a government now, as a local government, we are planning to step up our contribution, our local revenue from 13% to 20% so that it meets some of these costs. And secondly, I want to talk about illegal payments in health facilities. He talked about it. these are happening because now health workers are faced with a situation where they have the patient, they have diagnosed, and there are no drugs available to combat this particular health problem. Now, the only thing is now to put before this patient, this is what is happening. Now, that is where, on gentleman's understanding, the clients pull this money to say, let's have this. Ideally, that kind of thing is not allowed in health facilities, but it is a situation of what to do. The allocation is not enough. The other thing I want to talk about, low staffing in health facilities. As a district, we stand at 79%. As a chairman of the district, to me, with my chair, social services, that is not enough. We want to step this up. Why? Because the number of patients, the number of staffing in health facilities, we call staffing norm, is still using the figures of 1991. And yet every night, every day, people are producing. So we feel this must be stepped up. This is a policy issue that we are taking up seriously to see that the staffing level is improved upon. And also the health center grades are upgraded. They are upgrading. So we need to consider this now. Low staffing, we have tabled that before Ministry of Finance, Planning and Economic Development for wage bill. Now, one thing which is clear in this district is for the last 2 years there was no district service commission, and government kept sending wage bill, which wage bill kept being returned because there was no district service commission. As a chairman, what I did was to swing into action with my chair and the council members to quickly constitute district service commission, so that we begin now recruitment, so that we don't have people in acting positions, we fill the staffing gaps. Now, the challenge is, in November, we've submitted this. It was not considered. Again, in January, we had to sit down and make another resubmission for wage bill, which again has not been, considered. As I talk now, last week on Wednesday, I decided to say, you cannot enjoy the comfort of sitting here when we have our staff efforts spread thinly on the ground. Leave this district, go to Kampala, make a follow-up, add a human touch, because we kept making phone calls. So as I talk now, he's pursuing it. Maybe he's on the way coming back with good news. I want to hear whether this has been allowed, the staff wage bill, so that we recruit the required cadres of staff in these health facilities. The other thing that he brought about was inadequate accommodation. My sister, Honorable Nalatela, talked about it. Even right now at the Bondo Health Center, under Dr. Deep, we have construction of a semi-detached staff house, which is already awarded to a contractor, because that health center is going to be a health center grade 4. Now, by policy, we have also agreed that that health center must be fenced. The community, together with the Uganda Electricity Transmission Company Limited, agreed on what is called corporate social responsibility to a tune of 10 million to help in fencing the health center. So these are our efforts that we are trying to put in place to respond to community concerns. So a lot more is desired. Even when these things are brought, challenges are brought like this, to me, it is a sign that we have work to do. We have to all the time scratch our heads to see that these challenges are overcome. Okay. For leaders, challenges are opportunities to climb to another level. That is what I can say about this. Now, about the referrals, he talked about the ambulance. At the health center, we have allocated one ambulance in Bondo, donated by Honorable Osoru Morin, that was there in the district. We said it must be located within River sub-county, covering referrals there. Now, the ambulance in Kuluva is to cover the lower part of Vora plus Ajie sub-county. The ambulance at the district covers the upper part of Vora sub-county plus Logiri. So I do not expect challenges in terms of patient referrals. I am told the issue on the ground is a driver. They say the driver is not there on the ground, but we have a Arivo sub-county local government. The only thing is through the sub-county leadership, they get a competent driver provided this person has a permit, and then put this person to drive at such a time T when the district has a provision for recruitment of drivers. This person is regularized. Is regularized into the system. So it becomes very easy. As we talk now, we have staffing gap for drivers.
So what staffing gap, does it mean someone is relaxed? Someone is not doing his or her work?
No, staffing gap means this is the standard, but you are sort of the standard.
So who is supposed to follow up with that?
No, that is the responsibility of the district.
Okay.
Now, where ambulance is located in Arivo, Arivo has to help and get somebody within, because it's all about getting things going.
Okay. Thank you so much, Mr. Alfredo Kwanje. That is the chairman, LC5 Arua District. Listener time check is 13 minutes to the top of the hour of 8 p.m. And if you've just tuned in, this is Radio Pacis 94.5 FM, Peace of Christ for all. My name is Chek, and I have guests from Arua District for talk show sponsored by Sehad. Right now, the lines are open, 0701 887708 and 03932732 and 32. Manior bitodisi megbara sasi line anjidibo toko aziri toko alo aro aziri aziri toko aro kanko toko naoro mina kalid naziri kalinad ni iri azini kalinad ni iri zitani kanko ya joba. Radio Pacis. Hello. Your name and where you're calling from? Miradi? Kizito ngazungwa?
Kizito yawa.
Ngazungwa?
Dupi.
Oh, Dupi ya?
Or for programs.
Or for a person.
Sanga yuzuni. Yo kore. Yo arovu di abaku di kompen lema zo pusinga mak. Political leader sidiki. Deka kiasi amani rejuwa dile. Kiyo yemuyo di kia addressira. Those who are so interested here in the action you in the Mavu of County about your problem are looking money. Soon I was actor only. Way not necessary. Tabat Maza Colon the Kiko, whatever dear. You don't know the Kibaki above SSC. Taxes in one set. You're the left in that side, resting room of Picassinga, Ikindo. Don't ambiri. Your Aru Gunga Lega Obadro. Padre, the castle level, you know the address. You think at the keyboard of Pacis. Pa, if in a call, as if you on a board, the care room. In a ballet, you must pretend to kind of you Gafted to Kira Kishi about 4 problems.
Our four. Now yes. Okay, the lines are still open. 0701887708 03932732 and 32. Someone through the SMS line says, Pacis, this is Drazu Daniel from Okea. I appreciate the program. The health workers really need to be accommodated within the health unit since they save lives. But Arua District, being one of the youngest districts in the country, needs time to get recognized and borrow a leaf from former Arua District. Otherwise, like the talk show, also part of Arua District. Okay, that's Drazu Daniel. Keep the messages coming through the SMS line. Unfortunately, we have only 10 minutes remaining. Radio Pacis. Your name?
I'm John.
John from? Yes, John, speak up.
I want one question.
Yes.
One of the challenges these people raised was all about the accommodation and transport. How will they address the issue of transport when vehicles or ambulances keep on getting lost at the hospitals? Thank you very much.
You're welcome. How will that happen? Okay, maybe they will respond straight away without wasting time. We only have 9 minutes to the top of the hour. Let's keep responding to the raised issues. They can do all over can you can respond with. You can start with any and start with your names and titles.
Yeah, thank you. Izito from Uduki. Thank you for your concern. Is it true? The issues we are raising here, or we are responding to here, started some times back and they continue. Like the staffing issue, theft of drugs, all this. As a government operates like a family. In a family, sometimes you do not have resources to put things all at a go. Like you can budget your children, you buy clothing for them one by one. So the issue of accommodation, we first plan for them, then we implement the plan. But it should be continuous. Then the issue of theft of drugs. Theft of drugs, I think we have emphasized. We are empowering the community members that should you get someone with the drugs in his or her clinic on which they are written UG means Uganda government. This you report them even without mentioning your name. Report there is a whistleblower. A whistleblower's name is not supposed to be mentioned. So you just take the information.
Where?
Then you can bring the information to us as leaders. Then we shall know where to go. Some people out there, they are a little bit empowered. They can even go. You can even go up to IGG. You can go to police, so that the follow-up of these drugs can be done. We don't mention your name. Sometimes, Mr. Moderator, Chairman NC5, and the listeners outside there, sometimes people fear to report certain things because they say their names will be out, and the people they report will follow them. And
also because maybe they don't have the evidence, because you're saying they should go even without the evidence, but so long as they've seen it somewhere. So now
I am saying if you get the drugs from my, for example, I am a clinic operator, and then you have bought drugs from my clinic, and on those drugs is written UG. That means that is a drug of Uganda government. So you will already have that evidence. The evidence will be the drug you have bought, on which is written.
So that means I should first buy.
Yeah. Otherwise, someone can buy the drugs from a pharmacist and they bring to his or her clinic, and they will have no evidence. And the drug stock out is not only maybe because of the drug theft. You remember here the chairman explaining the amount of drugs which are planned for each health facility vis-a-vis the population outbreak. You know, the population has grown up and the plans have still remained some decades a year ago. So we need to revise the number of drugs or the amount of drugs which come to our facilities. But I do not deny or I do not throw away that I call it allegation. We call it rumors. In health, any rumor is a healthy act, and it must be acted upon. I can even come here and report that there is an outbreak of cholera in my village, and it is up to the health
team to follow up.
Yes, and the leaders to follow it up. So in health, any rumor is very important. You can even create any rumors and it will be followed up. Now we shall not leave that one.
Yes. So there was a point where he said these issues started way back before we were born, and they keep happening, and the talk is the same. Like we shall address. So why can't you one time come with a feedback like we have managed this?
No,
this is that.
Actually, I'm almost coming to.
Okay. It's okay. Maybe someone wants to come in.
I just wanted to say, yesterday, there were a number of people, a number of health workers who were paraded to court yesterday for theft of drugs here. In the city here.
Those are the stories people want to hear.
Yes,
so all us journalists, we publish them.
Yesterday it happened. And the prison was, actually the police was full over the weekend just because of this. So we are not resting, we are swinging into action seriously.
We have 3 minutes.
He has, Kizito was saying, Arojwasi, Badi. Adanisi eyoba GP adilete azoma birani bazio eyoba GP arodwari, it has a lot of costs. Azin si badi toki yo miozanga midele rumi ruani sursi yo diledi iki mu ngoni itetasi udu azin si arodwa afandede even badi ni ovu badani si bandrete yo ndekili bazi antinental clinic yake na okode niko ndreima period ya sizuru ngwara yakini yevle period ya sizuru ini kumamu yevla gupirizi. You know, some of these things are very interesting. My area, prevention is better than cure. Sende bani fe amani arodwa sende aro isuzuru erluili firi adule ili alope temisu ndragu aludule ririmu eri antibiotics onvu azirsi bato uyazi yapeni aziri aro ba mudrini dile riri dodu alo eyo ndere rewaro eyo arodredi amamobinga azoga kuogaga aga bani muzo atizo arodwara eyo teba jipi arodwara mawudi yo dibande pirari. Now, bazi ninze yo accommodation ria adada drazu Daniel amangatici drazu kiliru district amano dekwaru diriba mezo erimeta district kiliru ni pietualo kanirane ba yadia oni ba idrisi tualo emintroki wa mavu ofisia parimani resore eri eni tileni mbo batir ni fezo egata fezo bani usizu anibene askuna fariro kunu usirle.
Okay. And lastly, someone talked about the ambulance. How to manage the issue of the theft of ambulance happening in the district. I mean, they're happening in Uganda, so how are you going to address that? Maybe respond to that and give your final remark.
This is the undesired outcome. It's the least expected. We do not expect. The culprits, by your already they will be brought to book. They will be brought to the book, obviously. Now, Gamete Nigirkonda, Sidria Sibo, Gudaledi Bedinir Bezo, Tenga, Arua District, Amatenga Te, Muyon, the EPD, then Valaya Manu Guku.
Okay, at 4 minutes, Sali Diamara, Tazamidia Matura, and okay, and father to know Pidipatoria, and maybe your last remark. Yes, and that is Mr. Peter Etero.
Thank you very much, especially to the leadership of the district for the great work they are doing on issues of health. Our goal is just that we need to sustain the pressure to ensure that everybody does the work they are paid to do. If you're supposed to be in a health facility, we need to make sure you are there.
Okay.
There are strategic things that are difficult to handle because they are policy in nature that take long conversations. But there are simple things that we can resolve and improve health for everybody.
Okay, thank you so much, my guests, for coming, and also listener for being part. I love that participation. Up next is the Come Home program. My name is Check.